You know, there are a few things that instantly spike a pet owner's anxiety. Quite like hearing that sound, a persistent cough, maybe seeing them struggling to breathe,
Oh, so
seeing your normally energetic friend suddenly just exhausted. It's
hmm,
it's terrifying and your mind just races
yeah,
what is going on inside their chest.
that fear is completely valid. And in those moments, one of the potential diagnoses vets have to consider is pneumonia, specifically bacterial pneumonia.
Exactly. And that's really our mission for this deep dive. We've dug into some key veterinary sources all about this topic, bacterial pneumonia in dogs and cats.
Hmm.
Our goal is to kind of cut through the jargon, pull out the essentials, what it actually is, why it might happen, how vets figure it out, and crucially, what the treatment looks like.
Yeah, the practical side.
Right. We want to leave you feeling more informed, maybe a bit more prepared if you ever, heaven forbid, face this with your own pet.
Okay, let's unpack this then. What exactly is bacterial pneumonia sort of at its core?
Good question.
Well, think of it as an acquired infection, yeah, and a really intense inflammatory reaction happening deep inside the lungs.
Okay.
The sources describe it as the body having the strong response to uh, virulent bacteria, harmful bacteria
Yeah.
that have managed to get into the delicate lung tissues.
And that reaction causes problems.
It does. It triggers a buildup of fluid and inflammatory cells right inside the tiny airways and those little air sacs where oxygen normally gets absorbed.
So how do these bacteria even get down there? Is it just like floating in the air they breathe?
That's definitely one way, inhalation, literally breathing them in, yeah.
Okay.
But the sources point out that another really common route, perhaps even the most common, is aspiration.
Aspiration. What's that
That's
exactly?
when something foreign could be food, water, even stomach contents if they vomit or regurgitate gets accidentally inhaled into the lungs.
Ah, down the wrong pipe.
Exactly. Instead of going down the esophagus to the stomach, getting there through the bloodstream from somewhere else is possible, but the sources say it's less common.
Okay, here's something that really jumped out at me from the sources. It's quite surprising. You'd kind of assume the windpipe and all its branches, the tracheobronchial tree would be sterile, right? Like a clean tube.
You absolutely would think that, but the sources are pretty clear it's not.
Really?
They,
Yeah.
bacteria that normally just live in the mouth and throat, the oropharyngeal bacteria,
Mhm.
they're actually aspirated into the lower airways in small amounts all the time, even in perfectly healthy animals.
Wow. So just finding bacteria there doesn't automatically mean pneumonia. That kind of flips my whole assumption.
Exactly. Their presence is normal. It's when something else goes wrong,
Okay.
like maybe the type of bacteria that gets down there or the sheer amount, and this is critical,
Yeah.
something's wrong with the body's own defenses.
Right.
That's when these normal residents or maybe some new invaders can actually set up a proper infection.
So what happens then once they do establish an infection? How does the body react?
Well, it kicks off this whole inflammatory cascade.
Hmm.
The bacteria themselves, they're not just passive. They often produce these proteins the sources call invasins.
Invasins, like invaders.
Kind of. Think of them like little chemical tools or keys that help the bacteria break down the body's defenses and spread through the lung tissue.
Nasty stuff.
Yeah. And the body responds, leading to two main phases described in the sources. First, there's an exudative phase,
Exudative.
meaning fluid and proteins leak out from the blood vessels into the lung tissue. It's almost like a localized swelling deep inside.
Okay.
Then comes the leukocytic migration phase. That's when the body rushes in its defense cells, white blood cells, especially neutrophils, to fight the bacteria.
The cavalry arrives.
Right. But this flood of cells and fluid can actually cause parts of the lung to become dense and solid. That's called consolidation.
And that's bad.
Yeah, it damages the tissue and blocks up those tiny airways, making it hard to breathe.
Okay, so given all that, who's most vulnerable? Is there a type of dog or cat that's just, more likely to get this? It's
Yeah.
definitely not random. While any dog or cat can get it, the sources do indicate it's quite common, particularly in the very young and the older dogs.
More so than cats.
It seems to be less frequent in cats overall. Yeah.
Are there specific breeds or types of dogs mentioned?
Yes, actually. There's a note about dogs over 12 kilos having a bit of a predisposition, especially sporting breeds, hounds, working breeds, and interestingly, mixed breeds too.
Huh. Mixed breeds.
Yeah. And a lot of cases are actually seen in dogs under 1 year old. which, points towards those developing immune systems maybe being a factor.
Makes sense.
And there's a slight male bias noted too, around 60% of cases.
Okay, so this brings us to the why. The sources really seem to hammer home that bacterial pneumonia often isn't the first domino to fall, right? It's frequently triggered by something else.
Absolutely. Think of it more like an opportunistic infection.
Hmm.
If the body's normal protective layers are weakened somehow, or if there's a physical issue creating a pathway for bacteria, the risk just skyrockets.
The sources list several really key factors. Pre-existing viral infections,
Right.
that's a big one.
Right. Why does a virus open the door for bacteria, though? I always kind of thought of them as separate battles.
They are separate, definitely. But viruses can act like, well, like a wrecking crew for the lung's natural defenses.
How so?
The sources explain they can damage the lining of the airways. That makes it easier for bacteria to, stick.
Oh,
They
yeah.
can injure or slow down those tiny little sweeping hairs, the cilia.
The ones that clean things out. Right.
Exactly, that tiny conveyor belt. Viruses mess it up. And they can also impair the function of the immune cells, the ones that are supposed to gobble up bacteria.
I see.
So a viral infection can basically cripple the body's ability to clear out bacteria that might already be hanging around or get breathed in.
That makes total sense. It's like the virus disarms the security system. What about physical issues like with swallowing?
That's another huge category, yeah. Anything that interferes with normal swallowing or leads to regurgitation, that dramatically increases the risk of aspiration.
Right, the wrong pipe problem again.
Exactly. Includes things like dysphagia, just difficulty swallowing or frequent vomiting, frequent regurgitation. If that material goes down the windpipe instead of the esophagus,
That bacteria go right with it.
straight into the lungs, bringing bacteria from the mouth or throat along for the ride.
I guess actual physical defects make it worse.
For sure, actual physical or functional problems with the airway or esophagus are major culprits. The sources mention things like laryngeal paralysis.
Where the voice box doesn't close properly.
Right, so stuff can slip into the airway during swallowing, or megaesophagus, where the esophagus is enlarged and floppy, so food just sits there and can easily be regurgitated and aspirated.
Oh, wow.
Even things like a cleft palate in a puppy or kitten creates a direct opening. And then there's primary ciliary dyskinesia, that condition where those cleaning hairs just don't work right from birth.
What about pets who are maybe less aware, like sedated?
Yes, absolutely. Any state of reduced consciousness, stupor, coma, even just being under anesthesia, makes the pet less able to protect their airway. Big aspiration risk.
Makes sense.
A foreign object actually stuck in the airway is another one. It can physically introduce bacteria and cause inflammation right there. And other existing lung conditions, like bronchiectasis.
What's that again?
It's where the airways become abnormally widened permanently. Those widened areas can trap mucus and bacteria, making infections more likely.
Okay, and then there's the immune system itself.
Definitely. Anything that weakens the immune system generally. Immunosuppressive drugs are a big one. Chemo, certain steroid doses. They obviously make pets more susceptible.
And other diseases.
Yeah, severe metabolic disorders, things like advanced kidney failure or uncontrolled diabetes that actually impairs how well the immune cells work. Cushing's disease, too. These can all significantly weaken the body's ability to fight off infection. Sepsis, of course.
And I assume just being very young or very old plays a role.
Yeah.
Or not being vaccinated.
Precisely. Very young animals. Their immune systems just aren't fully developed yet.
Right.
Older animals might have age-related decline or other underlying health issues, making them weaker. And yeah, not being vaccinated leaves them open to those initial viral infections we talked about.
Which then paved the way for Monteria.
Exactly. The sources also mention some rare, specific immune deficiencies, too.
I saw a quick note about Irish wolfhounds, something genetic.
Yeah, that's an interesting specific example the sources brought up. They have this recognized syndrome involving chronic rhinitis, like a runny nose, and bronchial pneumonia. It suggests there's a genetic predisposition there, though the exact genes aren't fully worked out.
Fascinating. And finally, just their living environment.
Absolutely critical, especially in places with lots of animals, like kennels or shelters.
Yeah.
Housing density, the sanitation protocols, how good the ventilation is, all of that can really impact how respiratory bugs bred and concentrate. It definitely increases the risk of outbreaks.
Okay, so with all those potential underlying issues and risks swirling around, what are the actual signs an owner might see at home? What should make them worry?
The most common things you're likely to spot are probably a cough, difficulty breathing, or just increased effort to breathe.
Like belly breathing.
Yeah, sometimes. Reluctance to exercise is a big one. A drop in appetite, or maybe not wanting to eat at all, anorexia. Weight loss can happen over time, just general tiredness, lethargy, and sometimes you might notice nasal discharge.
And what might a vet pick up during an exam? Anything different?
Well, they look for those same signs, the cough, the breathing changes. They'll check for a fever, measure the breathing rate, but critically, they'll listen really carefully to the lungs with a stethoscope.
What can they hear?
They might hear sounds that just aren't normal. Like breath sounds might be louder than usual, or they might hear harsh bronchial sounds in areas they shouldn't. Crackles are common. They sound a bit like Velcro being pulled apart or popping, maybe wheezes too.
Okay.
They'll also check for dehydration, confirm any weight loss or lethargy the owner reported.
All right, so we know what it is, why it might happen, what it looks like. This leads to a really important question. How do vets actually figure out which bacteria is causing the trouble? Or even be sure it is bacterial pneumonia and not something else?
Yeah, that's the diagnostic puzzle, isn't it?
Hmm,
Vets start by thinking about other things. It could be the differential diagnoses.
might be.
Things like viral pneumonia, fungal pneumonia, even parasites causing lung issues. In cats, asthma can look similar sometimes. Lung abscesses are possible, or that foreign body we mentioned earlier.
So what tools do they use to sort through those possibilities?
Lab work is often one of the first steps. A standard blood test, the CBC, might show an increase in those inflammatory white blood cells, especially neutrophils.
Might?
Yeah, and the sources make a really important point here. Not seeing those changes on the CBC absolutely does not rule out bacterial pneumonia.
Okay, good to know. It's not definitive.
Not on its own, no. It's just one piece. However, arterial blood gas analysis, that's highlighted as a very sensitive way to check how well the lungs are actually working, specifically how much oxygen is getting into the blood.
And the source gave some numbers for that, didn't it?
Yes,
Yeah.
which is really helpful context for owners, I think. There's a measure called PO2, partial pressure of oxygen in arterial blood. If that's below 80 millimilli Hg while the pet's just breathing room air,
Okay.
that suggests mild to moderate hypoxemia, low oxygen level.
Even worse than that.
If it drops below 60 millimilli Hg, that's considered severe hypoxemia. It means the lungs are really struggling, and it's a critical situation.
Wow.
Vets might also use other tests like serology for specific viruses like canine flu, or maybe molecular tests if they suspect certain tricky pathogens.
But imaging, X-rays seem key.
Absolutely crucial. Chest x-rays or thoracic radiographs are essential to actually see what's going on inside the lungs.
What are they looking for in those pictures? What does pneumonia look like?
Well, the patterns can vary quite a bit depending on how the infection started and which bits of the lung are hit hardest.
Okay.
But often, they'll see areas that look whiter or denser than normal lung tissue should. That's because those areas are filled up with fluid and inflammatory cells instead of air.
Right.
Sometimes you can actually see the airways showing up as dark tubes within these white areas. The sources call those air bronchograms.
What does that mean?
It basically shows that while the tiny air sacs around them are filled with gunk, the larger airways leading into that area are still open, still contain air.
Mm-hmm.
You might even see complete consolidation, where a whole section or lobe of the lung just looks solid white on the X-ray.
And does it look different in cats versus dogs?
The sources mentioned that, yeah, cat X-rays can sometimes look a bit different, maybe more patchy, or sometimes they see small nodular changes rather than a whole lobe being whited out.
So X-rays show something's wrong, but how do they get the definitive answer on the specific bacteria involved?
Okay, this is another really critical takeaway from the sources. While X-rays show the problem and blood work might hint at inflammation, the definitive diagnosis and the best way to choose the right treatment really relies on getting samples directly from the airways or the lungs themselves.
How do they do that? Sounds invasive.
It can be. Procedures include things like a tracheal wash, where they flush a small amount of sterile saline into the windpipe and collect it back, or bronchoscopy with a bronchoalveolar lavage, or BAL.
What's that?
That involves using a small camera, a scope, to look down into the airways and then washing a small area deeper in the lungs to collect cells and fluid. Sometimes they might even do a fine needle aspiration directly into an affected area of the lung.
And what are they looking for in those samples?
Two main things: cytology and culture. For cytology, they look at the collected cells under a microscope.
What do they hope to see?
They look for lots of inflammatory cells, especially neutrophils that look damaged. They call them degenerate neutrophils. And ideally, they might actually see bacteria inside those inflammatory cells. That's a strong sign of active infection.
But what if they don't see bacteria?
This is the other crucial point the sources stress. Even if they don't see bacteria on the cytology slide, they should always culture the specimen.
Why?
Because bacteria aren't always visible. Or maybe they're just not numerous in that particular sample spot. Culturing is what grows the bacteria so you can identify exactly which species are there and, really importantly, figure out which antibiotics will actually kill them. That's the susceptibility testing.
That makes sense. Get the right weapon for the enemy.
Exactly. And the sources also mention if the pet has already been on some antibiotics before the sample was taken,
Yeah.
the cytology might look a bit different. It might show inflammation, but maybe no visible bacteria because the antibiotics have started knocking them back, even if they haven't cleared the infection yet. Still need that culture.
Okay, so the diagnosis is confirmed. It's bacterial pneumonia. What's the treatment plan look like?
Treatment is definitely multi-pronged. It's not just one thing. And often it requires significant support. For pets showing those really severe signs like not eating, high fever, significant weight loss, really lethargic, the sources strongly recommend inpatient care, hospitalization.
So it's definitely not just about, getting an antibiotic pill and sending them home.
Absolutely not. Supportive care is just as vital as the antibiotics themselves, maybe even more so initially.
Okay, like what kind of supportive care?
Keeping the pet well hydrated is crucial. Fluids, often IV fluids in the hospital. Why? Because hydration helps keep those respiratory secretions, the mucus, less thick and sticky, makes them easier for the pet to clear out.
Makes sense. What else?
Saline nebulization is incredibly helpful. That's basically having them breathe in a mist of sterile saline solution.
Like an asthma treatment.
Sort of, yeah. It helps to moisten and loosen those secretions deep in the airways, and it works best when it's combined with physical therapy.
Physical therapy for pneumonia. Tell me about that.
Yeah. It involves techniques designed to help physically move those loosened secretions up and out. One is chest wall coupage.
Coupage?
It's where you gently but firmly clap or cup your hands rhythmically on the pet's chest wall. The vibrations help shake the mucus loose.
Huh. Okay.
And then there's postural drainage. That involves positioning the pet in different ways, head down slightly, lying on one side then the other, to use gravity to help secretions drain from affected lung areas towards the bigger airways where they can be coughed out.
And when do they do this?
The sources emphasize doing this immediately after the nebulization treatment, when the secretions are hopefully nice and loose. And changing the pet's position frequently, even when they're just resting, is also key to stop stuff from just pooling in one spot.
Got it. What about oxygen?
Oxygen therapy is definitely given if the pet is visibly struggling to breathe, or if those blood gas tests confirm they have low oxygen levels, that hypoxemia.
And food, if they're not eating.
Nutrition is fundamental for healing. They need a high-protein, high-energy diet to fuel recovery. For severely ill pets who just won't eat, feeding tubes might be necessary to get calories in.
But you have to be careful.
Yes, there's a crucial caution mentioned. You have to be incredibly careful with feeding methods, especially tube feeding, in pets that have those underlying issues that put them at risk for aspiration in the first place, like megaesophagus. Don't want to cause another problem.
Right. What about activity level during all this treatment? Bed rest?
Generally, yes. Activity is restricted to allow the pet to conserve energy and heal. The exception is those necessary physical therapy sessions after nebulization.
Okay, all right. Let's finally talk about the antibiotics, the bug killers.
Right, the antimicrobials. They are, of course, essential. But ideally, the best antibiotic choice is guided by those culture and susceptibility test results we talked about from the airway samples.
But that takes time, right? What do they do in the meantime?
Exactly. Cultures take a few days. So in urgent, potentially life-threatening situations, vets will absolutely start what's called empiric therapy.
Empiric.
Meaning they start treatment with broad-spectrum antibiotics before the culture results are back. They make an educated guess based on the likely culprits. The goal is to start fighting the infection immediately.
What kind of antibiotics might they start with then, based on the sources?
The sources suggest initial combinations designed to cover a wide range of common bacteria. For example, maybe something like amoxicillin combined with clavulanic acid, plus another antibiotic like enrofloxacin, or maybe trimethoprim sulfonamide.
Covering the bases.
Exactly. Then, once the culture results come back, identifying the specific bacteria and showing which drugs actually work against them, the vet will adjust the therapy to be more targeted and effective. The sources list specific drug classes, effective against different types: gram-positives, gram-negatives, anaerobes. There's even a mention of using nebulized antibiotics, like gentamicin, specifically for bugs like Bordetella, often in addition to antibiotics given systemically.
Okay, this is really important for owners. How long does the antibiotic treatment typically last? Is it just a week or two?
This is such a critical insight from the sources, and is often much longer than owners might expect. The general rule of thumb given is continue antibiotic treatment for a minimum of 10 days after all the clinical signs, the cough, the lethargy, the fever, have completely resolved.
10 days after they seem better.
Yes, Andy. You also need to continue for 1 to 2 weeks after the changes seen on the chest x-rays have resolved.
Wow. So the x-rays lag behind.
Significantly. The sources really stress that the radiographic changes, the stuff you see on the x-ray, improve much more slowly than how the pet looks and acts outwardly. So you absolutely cannot stop treatment just because your pet seems back to normal.
That is a huge takeaway. They might look and act totally fine, bouncing around, but still need potentially weeks more medication because the lungs are still healing internally.
Absolutely. It's so easy to think they're cured when the cough finally stops.
Yeah.
But the infection and the inflammation can definitely still be smoldering deep down. Stopping too soon is asking for a relapse.
Okay. Now, I also saw a fascinating note about certain common medications that should actually be avoided during pneumonia treatment. That seems really counterintuitive.
It does, doesn't it? And it's another really important practical point from the sources for owners. Certain meds can actually make pneumonia worse.
Like what?
Anticholinergics and antihistamines, for example. They can have a side effect of thickening those respiratory secretions.
Oh, no.
Yeah, turning that relatively easy to cough up stuff into something more like sticky peanut butter. Much harder for the pet to clear out.
Okay, avoid those. What else?
Well, think about coughing. While a bad cough is distressing to hear, it's actually the body's main way of clearing the airways of mucus and bacteria.
Right, it's protective.
Exactly. So, strong cough suppressants, potent antitussives, should generally be avoided. You don't want to shut down that clearing mechanism when they need it most.
Makes sense when you put it that way.
The sources also mention avoiding certain drug combinations due to potential interactions or side effects, like using theophylline, a type of bronchodilator, at the same time as certain antibiotics like fluoroquinolones.
Good to know. And is surgery ever part of the picture?
Rarely, but yes, sometimes. If the pneumonia has caused a localized abscess, like a walled-off pocket of infection, or if it's caused by a foreign body that can't be retrieved any other way.
Okay.
And if the disease is really confined to just 1 or maybe 2 lung lobes, and it's just not responding to aggressive medical treatment, then removing the affected lobe, a procedure called a lung lobectomy, might be necessary. But it's usually a last resort.
Right. So how do vets track progress during all this treatment, and what can owners generally expect in terms of recovery time and outcome?
Monitoring is key. It involves regularly tracking the pet's respiratory rate and effort, listening frequently to their lungs to hear if those abnormal sounds are clearing up.
Checking the crackles and wheezes.
Exactly. Checking blood work again to see if those signs of inflammation are coming down. And, critically, repeating those chest x-rays.
To see if the lungs are clearing.
Yes, remembering what the sources said. The x-rays are slower to improve than the outward clinical signs. So repeat imaging is really necessary to confirm the infection is truly resolving and gone.
What about oxygen levels?
Arterial blood gases, if they were done initially, are a very sensitive way to see if oxygenation is improving. Pulse oximetry, that little clip on the tongue or ear, can also give a helpful, non-invasive estimate of oxygen saturation day to day.
Okay, so what's the bottom line? What's the prognosis usually like?
Well, the good news is that with prompt diagnosis and aggressive treatment, including all that vital supportive care we talked about, the prognosis is generally good for many pets.
That's encouraging.
It is. However, the sources are clear that it's more guarded, meaning less certain, in specific cases.
Why?
Very young or very old animals. Those with severely weakened immune systems for whatever reason. Pets that were already debilitated by other serious health problems before the pneumonia hit, or those with really severe underlying diseases driving the pneumonia.
And are there potential long-term consequences, even if they recover?
Yeah, unfortunately, prolonged or particularly severe infections do increase the risk of developing chronic bronchitis later on, or that condition called bronchiectasis, that permanent abnormal widening of the airways we mentioned. It can predispose them to future infections.
And what are the biggest factors that put a pet at the highest risk of not making it through an episode of bacterial pneumonia?
The sources are pretty direct about this. The highest risk of mortality, sadly, is associated with severe hypoxemia, those dangerously low oxygen levels in the blood that just can't be corrected, and sepsis.
Sepsis being?
Where the infection escapes the lungs and spreads throughout the entire body, causing a massive, overwhelming systemic inflammation.
Is there anything owners can do proactively to try and prevent this from happening in the first place?
Prevention really comes back full circle to managing those risk factors we discussed earlier.
All right.
Vaccination against common upper respiratory viruses is definitely important. It reduces the chance of that initial viral insult that can open the door.
What about for bacteria specifically?
Considering vaccination against Bordetella bronchoseptica, especially for dogs who have higher exposure risk, boarding, daycare, dog shows, that's definitely wise.
Makes sense.
And in those multi-animal environments, like shelters or breeding facilities, focusing on environmental strategies is key. Things like reducing crowding, having really good sanitation and hygiene protocols, and ensuring proper ventilation. That all helps minimize the exposure and spread of these pathogens.
So wrapping this all up, what does this deep dive really mean for you, the pet owner listening?
I think it means understanding that bacterial pneumonia in our pets is, yes, a serious condition. And it often doesn't just appear out of the blue. It's frequently linked to other underlying health challenges or maybe environmental factors.
And it's not hopeless.
Not at all. The really powerful takeaway from these sources is that with early recognition of those signs we talked about, getting prompt veterinary attention and committing to aggressive treatment, that combination of the right antibiotics and that crucial supportive care, the chances of a good outcome are actually high for many pets.
Yeah.
It absolutely underscores how vital it is for you to be observant of your pet's normal health and behavior, to be able to give your vet a really complete history if something changes, and then to work closely with them. That means diligently following the treatment plan. Understanding recovery takes time, especially that internal lung healing.
Absolutely. Okay, and as we finish up, here's a final provocative thought for you to chew on. Given how much the sources emphasize the role of those underlying conditions and your pet's general health and resilience, beyond just keeping vaccinations up to date, what proactive steps in their daily care and environment could potentially have the most significant impact on strengthening their defenses before any cough or breathing trouble even starts?
That's a great question to ponder.
Think about things like diligently managing any chronic illnesses they might have, like diabetes or Cushing's, minimizing potential aspiration risks if they have swallowing issues, ensuring their diet truly supports their overall immune health, and maintaining a clean, low-stress living environment. Where could you build the most resilience proactively?